This is Dirk Tousley, Golden Touch Records publisher. My business is communication, the exchange of ideas and emotions among people. Some ideas, some emotions are easily transmitted and readily understood. For instance, a man and his wife may communicate across a crowded room with only a smile, and the smile tells all. But most ideas are difficult to transmit in a way they can be understood. How well what you have to say is understood depends on how you say it in relation to the experience and intellectual capacity of the other person. This is especially evident in the communication of scientific ideas like chiropractic. Most people have insufficient knowledge of anatomy and physiology to understand a strictly scientific explanation. But the questions your patient asks about his condition and the efficacy of chiropractic are very real questions, questions that demand answers, answers the patient understands. This recording solves the communication problem between doctor and patient. You are about to hear 4 distinguished chiropractors tell some of the favorite stories and analogies they use every day in breaking the communication barrier. An analogy is a relation of likeness between two things, and as you will presently hear, there is an analogy for every condition and for every patient. Use the analogies you will learn here, but more important, learn to size up quickly your patient's ability to understand, so that you will always use the most effective analogy. You will find great joy in using analogies because at last your patients will understand what you are saying.
This is Dr. Rolla Pennell. My favorite analogy answers a question chiropractors frequently encounter. A patient will ask, "Dr. Pennell, what is the difference between chiropractic and medicine?" I reply, "Mrs. Smith, medical doctors and chiropractors work in different ways. If your home becomes overheated, there are 2 things you can do. You can open the windows, or you can adjust the thermostat controlling the furnace. By the same token, if your home becomes too cool, you might put on an overcoat to keep warm, or you could correct the trouble by turning up the thermostat. Your nerves control and regulate all of the glands, organs, and tissues of your body in much the same way that a thermostat controls your furnace and regulates the temperature of your home. Medical procedures are much like opening the windows in an overheated house or putting on an overcoat when the house is cold. They are often effective, but fail to correct the real cause of the trouble. On the other hand, chiropractic methods are like adjusting the thermostat. Chiropractors remove nerve interference, thereby restoring natural, normal function. This clear, easily understood analogy can be adapted to answer questions concerning virtually all conditions. For instance, a patient may ask, "How can chiropractic do anything for diabetes?" I reply, "Mrs. Smith, diabetes develops when the pancreas gland fails to secrete enough insulin. Nerves control and regulate all glandular functions in much the same way that a thermostat controls a furnace and regulates the temperature of a home. If your home becomes too cool, you might put on an overcoat to keep warm, but you could correct the trouble by adjusting the thermostat. Chiropractors correct the cause of diabetes and other glandular conditions by removing nerve interference, thereby restoring normal function." It is easy to see that this analogy can easily apply to conditions characterized by subnormal functions such as anemia, paralysis, low blood pressure, and constipation. Use the open window analogy instead of putting on the overcoat when you want to explain about conditions involving hyperfunction, such as high blood pressure, tachycardia, diarrhea, and fever. Another question people frequently ask is, "Why do chiropractors use different methods?" I reply, "Different chiropractic methods are like different makes of cars. One doctor may drive a Ford, another a Plymouth, a third a Chevrolet, depending on which one suits him best. Although different, all are capable of taking the doctor where he wants to go. It is the same with different chiropractic methods. Although different, all are based on the same principle: adjusting spinal bones to remove nerve interference, thereby restoring normal function and natural health. A patient may say, "Dr. Pennell, I've had these attacks of lumbago before. I always tough them out for a few days and then I'm all right again." I say, "Mrs. Smith, if you were really all right after the pain goes away, you wouldn't keep having reoccurrences. When you have one of these spells, unless your spine is adjusted, it is likely to heal in the wrong position, just as a broken arm or leg will often heal crooked if it is not properly set. When your spine heals in a wrong, out-of-balance position, nerves to vital tissues and organs are impinged, and the spine is weaker than it should be, resulting in frequent re-injury. Spinal joints often become damaged and calcified. Let's not let this happen to you. Let's stop these attacks. I recommend that you place yourself in my care and let me completely correct this problem before it gets any worse. Let's get started now. You've had this condition long enough." When a patient says, "Dr. Pennell, how soon do you think I can cut down on my adjustments?" I say, "Well, Mrs. Smith, one day last winter I saw a small boy walk across a frozen pond without trouble. But a few minutes later, a bigger boy tried it and broke through the ice. In your present condition, you're still on thin ice. I know everything seems all right, but believe me, the slightest additional load or strain could be too much. We'd better continue your adjustments until the danger of a relapse is over." I use analogies like these many times each day. My patients understand these analogies, and as a result are able to understand chiropractic.
In explaining chiropractic to a patient, use his language. Explain in terms he understands. Use analogies in your explanation. Pick an analogy that is suited to your patient's work. For instance, if the patient is a plumber, use an analogy that fits in with his knowledge of pipes and water. An electrician is sure to understand an analogy of wires conducting electricity, of switches and electrical tools. To explain a point to an automobile mechanic, tell a story of an automobile breakdown. A housewife will understand an appropriate analogy concerning household appliances, dress patterns, and recipes. Use a story of train orders and tracks to a trainman. To a contractor or construction worker, talk in terms of blueprints. And to a trucker, explain chiropractic principles with the story of a road map. Be sure you do not use the wrong analogy. A housewife is unlikely to understand an analogy about wiring of an automobile, and it would be unusual for a trucker to understand an analogy about a dress pattern. Here is an analogy that will help you answer a question chiropractors are frequently asked. The question goes something like this: "Doctor, how can a pain in my foot have anything to do with my backbone?" Here is the way I do it, and almost everyone understands. In the simplest of terms, I explain how the brain controls the body by sending messages over the nerves. I explain that the nerves leave the base of the brain and that they thread through the spine and emit between the vertebrae to go to the various parts of the body. And in the case of the leg complaint, I explain that some of the nerves lead into the lower portion of the back, emit between the vertebrae there, and continue down the legs. I squeeze the back of the patient's neck with my hand and say, "This causes pressure on your nerve, just as a misaligned vertebra will do." Then I illustrate the course of the nerve fiber leading to the leg by sliding my other hand down the spine and out to the leg, and I say, "This pressure here in your neck interferes with the nerve energy that flows over the nerves as they lead through your spine, out through the area here, and down to your foot." This usually explains satisfactorily the question: how can a condition in one part of the body be caused by a condition in the spine? If the patient is still doubtful, I flip the light switch on the wall and call his attention to the fact that the light in the middle of the room went out when I flipped the wall switch. Everyone understands that illustration. The patient will readily see that an impinged nerve in the spine may cause a disorder elsewhere in the body. But suppose a condition low in the spine is affecting the upper region of the spine. I use this analogy. I compare the pelvis of the body to a church and compare the spine to the church steeple. I explain that if the base of the church were tilted, then, logically, the steeple would also tilt. And I say that the same reasoning applies to the pelvis and the spine. If the pelvis is tilted, then the spine also will be tilted and strained, and the nerves will be impinged. Recently, an automobile mechanic came to me complaining of a heart condition. He could not understand how a misaligned vertebra in his neck could be the cause of his heart condition. I used the following analogy, and he understood perfectly. I said, suppose you have a good engine in your car. The spark plugs and cylinders are good, and the gas mixture is right. But because of an improper spark, the engine misses. Wouldn't you adjust the distributor points to make the engine run properly? And I continued the analogy by saying, you see, there is nothing wrong with the engine, but it's not getting the proper spark. The same thing applies to your heart. As an organ, there is nothing wrong with it. But due to nerve interference back here, where these spinal bones are twisted on the nerves leading to your heart, the heart cannot function well. My job is to relieve this nerve interference so your heart will get a good spark. A man was in my office recently who had difficulty understanding how nerve impingement in his neck could cause his hands to be numb. I used this analogy to explain so that he would understand. He was seated with his knees crossed. I said to him, John, if you sit here very long with your knees crossed that way, your foot will go to sleep, won't it? I gripped his knee with my hand and put pressure on the nerve posterior to his knee and said, you see, pressure on this nerve that leads to your foot interferes with the nerve energy, and your foot goes to sleep. That's exactly the way it is with your hands. You have pressure in your neck on the nerves that lead to your arms and hands. That pressure is caused by a bone in your neck that is slipped out of place. Sometimes a patient does not see the need for x-rays. He thinks that in every case the chiropractor should be able to feel the back and determine the condition of the spine. In such instances, I use this analogy. I say, suppose there is a Christmas package under the tree for you. You pick up the package and you feel it and rattle it. You may be able to tell what's in it, but you may be fooled badly. It's when I feel your spine. I may feel it and determine where the trouble is. Many times I would be right, but I could be wrong. And Mrs. Jones, we don't want to make any mistakes in your case. Let's take those x-ray pictures so we'll have full knowledge of what we should do. If a contractor or a construction man does not readily understand the need for x-rays, say this. These x-rays are to me exactly what those blueprints are to you. We're going to have to make some changes in this body of yours, and we don't want to guess how we should proceed. We want to know exactly. That's the way you do it in your business, isn't it? You get the blueprints so you will know exactly what to do. A railroad man is used to following train orders to make every movement. X-rays to me are exactly what train orders are to a train man. He understands train orders just as I understand x-rays. He wouldn't go out on the main line without train orders. What explanation should you give to a patient who has an acute disease and who may have to go to the hospital? Or what explanation should you give to the patient who has an inflamed appendix and who may need surgery? I explain either of these situations with this analogy. I say, suppose you were driving your car very fast along the highway. You look down the road and see that the bridge is out. What do? Well, of course, you apply the brakes immediately, but it may be too late. That's what we're doing with these adjustments. We're applying the brakes. Your condition has a lot of momentum. It's going very fast, and we may be too late in starting these adjustments. It may be necessary for me to recommend that you see a surgeon. Another situation where the bridge analogy is effective is when your patient undergoes surgery without your knowledge. When you find this out, use the bridge analogy. Here is an analogy everyone understands. It is especially appropriate when a patient has finished a course of adjustments. I say this: health is just like money in the bank, but much more valuable. When you first came into my office, your health was bankrupt. You had no reserve at all. Now this condition is corrected, and you are beginning to fill your bank of health again. You want to let me check your health frequently so that you won't become bankrupt again.
This is Dr. John Cullum. Here are a few analogies I use and find effective in explaining chiropractic to my patients. My first analogy is for a patient who has begun chiropractic care for a painful chronic condition and whose pain has been relieved after a few adjustments. Usually, she says something like this: "Dr. Cullum, I feel okay now. I think I'll stop taking adjustments for a while." I handle that problem by saying, "Mrs. Blank, not long ago, I found a possum in the yard. As soon as he saw me, he rolled over and played dead, even when I poked him with a stick. But as soon as I walked away and gave him no more attention, he came alive and ran into the woods. Mrs. Blank, your condition is playing possum. You seem to be all right. But if we stop your adjustments now and give you no attention, your old condition will soon flare up and become active and painful again." Analogy is a variation of the previous analogy, and I use it when a patient is almost well and wants to quit. I say, "Mrs. Blank, you're almost well. You can stop taking adjustments if you wish, but doing so would be like dismissing the maid because the house is clean. We need to concern ourselves with a maintenance program to keep you well." This is Dr. John Cullum. Here are a few analogies I use and find effective in explaining chiropractic to my patients. My first analogy is for a patient who has begun chiropractic care for a painful chronic condition and whose pain has been relieved after a few adjustments. Usually, she says something like this: "Dr. Cullum, I feel okay now. I think I'll stop taking adjustments for a while." I handle that problem by saying, "Mrs. Blank, not long ago, I found a possum in the yard. As soon as he saw me, he rolled over and played dead, even when I poked him with a stick. But as soon as I walked away and gave him no more attention, he came alive and ran into the woods. Mrs. Blank, your condition is playing possum. You seem to be all right, but if we stop your adjustments now and give you no attention, your old condition will soon flare up and become active and painful again." Analogy is a variation of the previous analogy, and I use it when a patient is almost well and wants to quit. I say, "Mrs. Blank, you're almost well. You can stop taking adjustments if you wish, but doing so would be like dismissing the maid because the house is clean. We need to concern ourselves with a maintenance program to keep you well." Analogy number 3 is appropriate in explaining chiropractic principles to a patient who has been taking adjustments for some time and who feels he is not improving. I tell this story. "Mr. Blank, it takes time to get well. Curing a stubborn condition is like a preacher converting a sinner. His efforts are not likely to show visible results for some time." Another answer for patients who don't feel improvement yet is the seed analogy. I say, Mr. Blank, it takes time for nature to get you well, just as it takes time for nature to develop an oak from an acorn. Often, a patient will express discouragement by mentioning the expense of a planned health program when he is feeling okay. My favorite analogy for this situation is what I call defeating the drought. I say, Mr. Blank, continuing your chiropractic care when you are feeling fine is like watering a green lawn during a dry spell. It costs a little, to be sure, but it's less expensive to maintain your established lawn than to neglect it and have to start a new one. Here is an analogy I use nearly every day. Many of my new patients have suffered injuries causing severe distortion and misalignment of the spine. In cases like this, I often have to recommend an extended period of chiropractic care. An apt, understandable analogy is especially important to help the patient understand the reason for repeated adjustments. Here I use a dental analogy which everyone seems to understand. It goes like this. Mrs. Blank, correcting a defective spine is something like straightening teeth. If a dentist were to straighten badly aligned teeth in one treatment, the tooth sockets would be so badly damaged that the teeth might fall out. But of course he doesn't do it that way. He moves them a little at a time, which gives nature a chance to do her part. I'm going to do much the same thing. Each time you receive an adjustment, I'll make as much correction as I can. And although progress may seem slow at first, almost before you know it, you'll be well. When a housewife questions your recommendations for an X-ray examination, she'll understand immediately if you say, Mrs. Blank, an X-ray is as important to a chiropractor as a dress pattern is to a seamstress. We have all had the experience of a patient saying, I think I'll wait a while before I start taking adjustments. This is an easy problem to solve, but I surely lost many patients before I learned to use analogies. Now I merely say, Ms. Blank, putting off health care is just like waiting to make a will or waiting to buy life insurance. Sometimes waiting, even one day, is too long. Another situation you can learn to handle easily occurs after the first adjustment of a new patient when he says, Is that all you do? Yes, Mr. Blank, that's all I do. But the adjustment I have given you turns on the vital nerve energy to your entire body, just the same as an engineer turns on the power to an entire city by merely closing the master switch. During consultation, when a patient says, I don't know how it happened, doctor, it just started all of a sudden, I say, I understand. Sometimes it seems that way, just as a light bulb seems to burn out all of a sudden. But we know that it has been burning out for a long, long time.
All of us have in our practices a small percentage of patients who seem to get sicker before they begin to get well. At least symptoms are more numerous and perhaps more acute. Usually, this is caused by the tremendous momentum the disease process has built up. We as doctors understand this, but it isn't uncommon for a patient to adopt the attitude that you aggravated his condition. If a physician gave him a shot for pneumonia, he wouldn't think of blaming his increased fever on the shot, but he will at times blame the chiropractor for increased pain and discomfort or new and additional symptoms following an adjustment. The degree of complaint may range from minor irritation to outright hostility. He may say something like this: "Man, what did you do to me? I feel twice as bad today." Or, "That last adjustment sure stirred things up and aggravated my condition." When this situation occurs, use the following analogy to show the patient that a disease process often flares up, even though the right thing is being done to bring it under control. Say this: "Mrs. Jones, disease is like a house on fire. Sometimes a fire has such a head start, it flares up worse after the firemen begin putting water on it. But that's not the fireman's fault. Let's check you over and see what has really happened." Similarly, chronic conditions and disease processes of long duration are naturally slower in responding than an acute condition. Chronic diseases build up a steady, consistent, destructive inertia that isn't easy to stop. Initial improvement often is slow in coming, and sometimes the disease seems to grow steadily worse because of the momentum it has built up. This situation is a natural breeding ground for discouragement, and you, the doctor, should head off such negativity in your patient by showing clearly the true nature of chronic disease. Immediately following the first adjustment, and before letting the patient off the table, say this: "Mrs. Jones, in conditions like yours, 30% of the patients notice improvement after the first visit. However, sometimes the condition is like a team of wild runaway horses. You don't jump in front of the horses and stop them flat. You have to run alongside them a considerable way before you get them stopped and turned around. And the doctor doesn't jump in front of a disease and stop it flat. Sometimes disease has such a head start and momentum that it continues quite a ways and may become worse before it is checked and under control. Then you start back on the road to recovery. I hope you are one of the 30% who respond quickly, but if not, bear with it, knowing the right thing is being done for you." The reason for telling the patient to 30% notice improvement after the first visit is that you must not kill any hope the patient has for immediate improvement. This leaves the door open for those who expect to respond quickly and builds patience in those who may be slow to respond. Of course, every sick person wants to get well as quickly as possible. However, sometimes a patient is unduly impatient. He may have been sick for years, or he may have sustained a severe, damaging injury, and yet expect a miraculous recovery. Sometimes impatience is prompted by well-meaning friends who have convinced the patient to expect miraculous results. Other times, the cause is financial duress and worry about the cost. Whatever the reason, when you recognize impatience, say this: "Mrs. Jones, restoring health is like restoring a withered, dried-up plant that has been through a drought. You don't put water on a withered plant tonight and expect it to have lush, green foliage tomorrow. You don't expect it to burst into full bloom the next day. It takes time for nature's healing processes to work when disease has been dominant a long time. Just be patient. From all indications, your nerves are responding. You'll notice improvement soon." A common expression heard in a chiropractor's office is, "Doctor, I feel wonderful. I think I'll quit for a while and see how I get along." The patient would never say this if he knew what you know about disease processes and impinged nerves. When you hear a remark like that, take the patient by the hand and place his finger in a partially open door, and then gently, I said gently, close the door on the finger. While holding the patient's finger in this position, tell him the truth. Say this: Mr. Jones, an impinged nerve is like your finger pinched in the door. As soon as the door is moved back, even the least bit, the finger is relieved. But the finger wouldn't be safe left in that position when the least little push on the door would pinch it again and injure it more severely. You'd want the door to be open far enough to leave plenty of reserve space between the door and your finger. Likewise, as soon as a vertebra is moved back the least bit, it often frees an impinged nerve, and you feel better. But you surely wouldn't want to leave the vertebra in that position, where the slightest wrong move could slip the vertebra right back and impinge the nerve more severely. You need a cushion of reserve space between the vertebra and nerve, just as between your finger and the door. Let's work properly to correct this condition. Let's move that vertebra fully back to normal, so you won't have to worry about every little fall or strain causing a reoccurrence. Sometimes a patient will not fully accept your recommendations. He may have hope that you can help him, but also have doubt. Rather than commit himself to the 3 or 6 months' care you feel is necessary, he will say that he'll try a few adjustments and see how he gets along. When he indicates that decision, you look him straight in the eye and say this: Mr. Jones, a series of adjustments is like an operation. If a surgeon told you that you needed an operation requiring 3 hours on the operating table, you surely wouldn't tell him you'd try 15 minutes of surgery, would you? It would be better not to start. The same is true with chiropractic care. If for any reason you can't follow through with the minimum recommendation, it would be better not to start. For I'd rather not have you as a patient than fail to get results. You want to get well, don't you? Then let's do things the right way. Occasionally, a patient will not understand fully the need to be x-rayed and may ask if you feel it is absolutely necessary. Keep in mind that perhaps he has been under a chiropractor's care in the past and has experienced relief without x-rays. Your explanation must show the need for x-rays, but it must not discredit in any way chiropractors who have given him relief without x-rays. Always use the "in a condition such as you have now" idea. This lets the patient know you're basing your recommendations on what you find now. Depending upon the patient, his depth of understanding, and the circumstances of the case, make one of the following statements. In a case showing high nerve pressure, such as yours, adjusting without x-rays could be as serious as a surgeon operating with his eyes closed, and you certainly would not want that. Don't fool yourself. You have a problem, and there's only one right way to take care of it. And I believe that's what you really want, isn't it? When speaking to a housewife, say this: in a condition such as you have now, adjusting without x-rays is like trying to bake a cake with your eyes closed. Probably you could do it, but it would take longer and be a messy job. It's much easier to do it right. That's what you really want, isn't it? For a man, you could use either of the following. In a condition such as you have now, adjusting without x-rays is like trying to paint the woodwork with your eyes closed. You could feel your way along and do it, but is it going to be what you want when you're finished? It's much easier to do it right. That's what you want, isn't it? Or you say, in a condition such as you have now, adjusting without x-rays is like trying to mow the lawn with your eyes closed. You could do it, but it would not be the safest procedure, and you can't afford to take chances. It's much easier to do it right. That's what you want, isn't it? Notice that each of the preceding examples ends with a question requiring a yes answer, and that the decision is automatically made for the patient. Review these analogies frequently. Memorize them. Get them clearly in mind so you can use them easily and freely without hesitation. Say them over to yourself. This will put them within you permanently and let you call them forth when needed.